So this is my friend Melissa and her baby Mason, and she's letting me use him for my health assessment of an infant. So how old is Mason?
11 days.
11 days. Any issues prenatally? Any prenatal complications? Did everything go normal with the labor and delivery and postpartum?
Yep.
Did you have a vaginal or a cesarean delivery?
Vaginal.
Any issues with that? Any issues with stress or postpartum depression or any issues like that?
No.
What's his gestational age when he was born?
He was born one day before his due date.
So he was term.
Yeah.
Everything went well with the hearing screening and all the lab tests and stuff?
Yep.
Okay. Has he been for a follow-up appointment to his pediatrician yet?
No. Next Friday.
Next Friday. Okay. So he's bottle fed, obviously. What kind of formula do you use?
Enfamil.
Enfamil. And I actually just had her make a bottle, but because my camera malfunctioned, she used the appropriate amount of nursery water and formula. But now we're using my phone now. So how many bottles does he have a day?
About 8.
8. How often is that?
Like every 3 hours.
Okay. How many wet diapers does he have every day?
5 or 6.
5 or 6.
About.
And how many times does he have bowel movements?
Once.
A day. Once a day. Okay. And when he was born, how much did he weigh?
7, 11 and a half.
7, 11 and a half. And how long was he?
19 and a half inches long.
Okay. So he's obviously fussy when you take his bottle away. So in general, when I'm looking at the baby, I see his tone and his skin color and his vocalization of his cry. I'm going to, while mom holds him and burps him, take his temperature here under his arm. So it's normal. He's been undressed for a few minutes because he had to take his clothes off before the last camera stopped working. So would you mind laying him down here? All right.
You want this?
So I'm going to check his head circumference here, right above his ears. Over there. So he is like just under 36. Hi. I'm watching his movements. I want to see his ears are regularly set. He's looking around the room. I'm going to shine my light in his eye in a minute. Actually, first I'm going to listen to his lung sounds. Let me hold his pinky there for me.
I know, that's not what you want.
Listening to his heart sounds. He has normal bowel sounds. So I'm also examining his chin, looking at see that he can suck. I would take his binky out and make sure his palate is okay, that he doesn't have any cleft palate. Then I'm looking at his chest and looking at his respiration to see if there's any retractions or signs of distress. I'm looking at his nipples. They're a little bit swollen from mom's hormones. Looking at the umbilicus, his belly button has fallen off. Take his diaper off, and I would have gloves on. Peek at his genitalia. He's circumcised, no problems with the circumcision. I would check to see if both testes are distended, which I guess I'll do. Okay, yes, they're both there. I'm also going to look at his leg movements and do the Orlani Barthol maneuvers. Feel for hip flicks. He's got 5 toes. Just going to tuck your diaper back. Oh, then we would weigh him with his diaper off. So we just kind of pick him up and move him around. I'm also going to check to see how long he is. So I'm going to kind of stretch my tape measure here all the way down to his toe without him bending his leg. He's not going to like this. So he is 21 inches long, approximately. So he's growing. I'm also going to peek at his backside then and look for any kind of moles, skin issues. I want to check his bottom, make sure he has no tufts of hair or sinuses. And then I gotta figure out how to get. Do you have another diaper, Vern?
Yeah.
This one's wet. I better put this on. I have a bad feeling. So I'm also watching. He's doing his stepping reflex when I put him down like this. Here, I'll give it to you. You're so funny. So. I'm also at this time going to take his pulse. You can take it femorally or apically and count his respirations. So I'll just see if I can listen fast enough. He's gonna sit still. Oh, bless you.
Mommy.
It's hard to count his respirations when he's like wiggling for the bottle. And then I'm going to just shine my light in his eyes here. Sorry, Mason. It's going to be bright. I'm going to look to see if he has a red eye reflex, which they always close their eyes up, but they don't want to do this. Come here, buddy. Let me shine this here. Oh. Oh. You want to hold him up maybe and give me a bottle? I'll do it really quickly.
Yeah, that's what you want.
Oh, that's better. Can you look at me now? Look at me. Okay. And then again. Okay. So I think I got everything there.
Mommy, hi.
Didn't hear any heart murmurs.
Hi, Mommy.
What else? I think that's pretty much everything. I can also do his, he did his stepping reflex. I can check his Moro and his grasp. Let's see your grasp reflex. Can I have your hand? Hi. I see you're already doing it. Hi. And if he wasn't eating, I'm sure that he would actually do this better. And that's it, I think.
Do what?
Like if he wasn't eating, you touch his cheek, he looks around for the food.
Oh yeah, he does.
So then, at the end of every visit, I would give education. So, anticipatory guidance for follow-up would be make sure that you're putting the baby back to bed, and that he's not laying with any fuzzy blankets or anything with him in bed. That he has like a pair of pajamas on with footies. That should be good. You want to think about safety and make sure that he's not placed any place where he might roll off. And, you know, don't. When is the next immunization? You go see him on Friday?
Like for shots?
Yeah.
No, they said it 2 months.
So 2 months he'll go, so like another month and 2 weeks he'll go for shots, and call if you have any questions.